I'm Carol Lourie. I am a naturopath and an acupuncturist and a homeopath, and I specialize in providing mostly women with integrative supportive oncology care in my clinical practice in Berkeley, California, and I have an online program which I created to bring all this important integrative information to women throughout the world called The Path of Breast Cancer. I work primarily with breast cancer, but I also do ovarian cancer. And if people have questions about their type of cancer, I have lots of colleagues who do other types of cancers that I can refer people to. So I'm here to talk today about the benefits of intermittent fasting, which I did not do today because I ate breakfast. And I want to start with the animal kingdom. Penguins fast. The men take care of the egg, and they will stand there and hatch this egg until their mother comes back, their wife comes back, but they will not stand there until they die. So if the egg hasn't hatched and the mother hasn't come back, they will leave to feed themselves. And we know that lions go through periods of when they have catch and they eat, and then they fast. And lastly, bears will gorge themselves before they go into hibernation. So we have examples for intermittent fasting throughout the animal kingdom. And then in all religions incorporate some kind of fasting. We have Ramadan, in which you're supposed to fast throughout the day and you eat only at night, and it's all about going inside and thinking about how you can be a better person. And the Jews have Yom Kippur and Passover, in which Yom Kippur you fast for a day and you repent and you think about all the ways that you can be a better person. Yeah. And then we have Lent, and also the whole thing about Lent is you're supposed to give up something that's important to you so you can repent and self-sacrifice. Now, that's not an attitude that I hold, but this is what religion does with fasting. So the whole thing about fasting is recently there's a big resurgence of it, but it is not a new occurrence. And I think that it's interesting at a time when metabolic disease and chronic disease have become so large for humankind that all of a sudden fasting has come back as a cool thing to do. So, and I want to talk about us as humans. Prior to agriculture, there was always a concern about would there be enough food. And when you think about the people who went cross-country in the wagons to end up here, or down to end up here, there were great periods where they didn't have enough food, and there was fasting then. So food was not always as readily available as it is with the onset of industrial culture. And as the Industrial Revolution has increased, so has our metabolic and chronic and obesity and serious disease, heart disease and cancer being one of them. So I want to talk a little bit about the science of intermittent fasting. And so in 1809, which is the first recognition of fasting being mentioned in published medical journals, and they talked about how a woman was fasting, and I apologize to women, it's very sexist. It was 1809, they didn't know any better. And then in 1878, there was an autopsy done on a woman who had done fasting, and the male doctors noted that her organs were in excellent health. And here we go, fast forward to 1924, which is the Warburg effect, which is a topic dear to my heart. And the Warburg effect was discovered by this German scientist, Otto Warburg. And you have to remember that in those days, there was very little science about what was causing cancer and more or less how to treat it. And he was a German physiologist, and he discovered that cancer loves sugar. And here is this majorly complicated schematic, which people study for years, but the most important thing about it is at the very bottom, it goes into gluconeogenesis, and that is the important thing about Warburg effect, and I'm going to explain that so all of us can understand it. So cancer cells predominantly produce energy by a high rate of glycolysis, and let me just put this in English, you can read the slide. Cancer cells will choose sugar over oxygen. even though they will get less energy from the sugar than they do oxygen. And this is one of the main ways we can impact how our body responds to cancer. A lot of people feel like cancer is out of control in their body and they don't have any impact. But I'm all about helping people realize that cancer, yes, is a serious disease, and yes, we don't have to be a victim. We do have a lot of ability to impact how cancer grows and spreads in our body. So the Warburg effect explains how the insulin, which is about sugar, and blood sugar are impacted. And when you reduce the amount of fuel that cancer likes, you then are able to impact how it spreads and grows. So this is one of the ways that you can change your diet. The American Standard Diet is about creating illness. And the American Standard Diet, called SAD, Standard American Diet, is not only sad, but it's also very dangerous because it's filled with carbohydrates, and carbohydrates are transferred into sugar, and sugar promotes cancer. It's not just the carbohydrates, it's the huge amount of chemicals that are in the boxes that people are eating in fast food, and the horrible fats. But when you change your diet into a more Mediterranean diet or a more keto diet, you are feeding your body proteins and fats, and cancer cells don't like that. So this is one of the major ways you can impact how your body responds to cancer. So fasting, let's talk about chemotherapy, because this is what I do a lot in my practice. When you fast, what happens to the cancer cells is they get hungry. And then you go into chemotherapy, and the cancer cells go, oh my goodness, here's some food, and it takes up more of the chemotherapy. But what happens to your healthy cells is the healthy cells hunker down, and they go into protection mode. So this is one of the ways where women and men, if you're having chemotherapy, can go into chemotherapy and get the cancer cells to take up more of the chemotherapy, but the healthy cells are protected. And this can also result in less side effects. And I use intermittent fasting for all the people that I work with as part of their preparing for chemotherapy program. The thought of eating a steak like today and then having chemotherapy tomorrow is so scary to me, and people wonder why they get sick. I can't even imagine. So chemotherapy and cancer treatment is like a marathon. We have to prepare for it, and you have to go in with the right attitude that you know you're doing your best. So then in 1946, they were studying intermittent fasting with longevity in rats, and they found that rats increased their life by up to 20%. So intermittent fasting is not just about cancer protection, but it's also about living a healthy lifestyle and longevity. And as I get older, that's something that I definitely want to be here for. So I want to talk about the different ways to intermittent fast, because there are a lot of different ways. As there's been more research, there are more experts coming out and saying, oh, you have to do it this way and you have to do it that way. And there's like just so many things in life. There's no one way. You have to find out a way that works for you. So there's time-restricted daily fasting. And you can fast for 12 hours. That's TRF, time-restricted fasting. Or you can eat 8 to 24. You eat 8 hours a day, and you don't eat the rest of the time. Then there's something called caloric restriction, in which you're reducing your calories. Now, there's been some research about how many percentage should you reduce, because one of the concerns we have about cancer treatment is something called cancer-related cachexia, which is a very high, contributes to death, unfortunately, a lot, but it's also, very fortunately, something that we can prevent. So the whole thing about caloric restriction is it results in a consistent reduction of growth factors, which really feed sugar, promote sugar, anabolic hormones, inflammatory cytokines, and oxidative stress markers. So when you do caloric restriction, all of these 4 things which promote cancer growth are reduced. So once again, what's the ideal amount? They found that 20% useful for weight loss, but not what you need metabolically. 40%, it reduces the glutathione antioxidant capacity in the liver, and you don't want that. You want the glutathione antioxidant capacity in the liver because that's how you detoxify. And then they went into 50%, which they found actually was not good at all. Not good at all. So what, 50% caloric restriction, is that even possible for most people? And most Americans, we have a hard time with fasting. You can't go from having a standard American life and a standard American diet to say to somebody, okay, I don't want you to eat for 14 hours, because they found that the metabolic benefits of fasting start between hours 12 and 14, and they really peak at hour 14. So in order really to get the benefits of metabolic fasting, you have to fast for 14 hours. But in my practice, I'm not going to say to somebody who comes in to see me who's eating like a regular American high, you have to not eat for 14 hours. They're just going to think I'm ridiculous. So fasting is something that you have to work up to. So you can start with 8 hours. And a lot of people, unfortunately, they eat dinner and then they have a snack before they go to bed. I don't know how that came about in American culture, excuse me, but it does. So just stopping eating after dinner is a good beginning. And then you can extend how you fast by, when you wake up in the morning, first you just have some lemon water and you don't eat for an hour. And actually, Dr. Walter Longo, I'm talking about him soon, he says it's okay to have black coffee in the morning. I don't know about that. But so they found that 30% caloric restriction is ideal. And they found that it works for people and it works for metabolically for what you're able to get. Then there's something called periodic fasting. And that's when you fast for short periods of time. But you have to fast all day. So you can have a day where you fast and then you don't fast for 2 days and then you fast for a day. So it's on, off, on, off. So then there's the 24-hour day fasting. There's the modified alternate day fasting. And then there's 5-2, which is you eat normally for 5 days and you fast for 2. So as I said, there are many different ways to to fast. You have to find one. The important thing is you have to find something that works for you. There's no one way. Now, there is something called the fasting mimicking diet, and I want to start out by saying I'm not connected with Walter Longo at all, and I'm not getting any money from him, but I did interview him as part of my program, and I believe in what he's done because he's done an enormous amount of research. He's a scientist out of USC in Los Angeles, and he's written hundreds of articles about this and has really elevated our knowledge about what is intermittent fasting. So for people who absolutely cannot fast, this is a really viable alternative because you're eating food. He's created this entire program, which looks like this. And he gives you these packets, and you eat them at certain times of the day, and he tells you what to do, and you can live your life but still get the benefits of fasting. Now, I've done this a couple times, and I have to say, it's not that hard, but what comes up, and I think this is true for all of us, is when you decide to fast, your attachment to food and what it does for you emotionally comes up. And you have to be willing to sit with that uncomfort as you go through fasting. I mean, otherwise, you're just going to say, the heck with this, and start eating again. Because food and eating is really, it does a lot for us, not just physiologically, but emotionally and socially. So this helps with that, but there's no chocolate bars here. So he did a lot of studies about this. And so here we have his 2015 study about fasting and blood sugar and your insulin glucose factor 1 levels, and I'll be talking about that in a minute. But the whole point of it is that it reduced the insulin glucose factor 1, and we want that to be reduced because insulin glucose factor is one of the driving forces of metabolic environment for cancer cells. Then there's water-only fasting. Now, how I got introduced to this field is in the 70s, I was living in a spiritual community in New York City, and my roommate had cancer, and she found this doctor in Long Island. This was 1975, before detox was a major word, and he put people on these detoxifying diets with juices and blended salad and water fasting. So I was his assistant and helped a lot of people going through water fasting, but here we are now with research, and they find that water fasting is not so great for your gut microbiota, and it also didn't help people heal from wounds. So it's just something to consider. So how does this apply to you? How can you make this part of your life? I think anyone who has any serious chronic disease, whether it be cancer or cardiovascular or inflammatory, lupus, rheumatoid arthritis, and just anybody who wants to be healthy, we should all be doing some form of fasting every now and then. So the whole purpose of fasting is you want to create a differential stress state. And what that does to the cancer cells is it discombobulates them. Anything we can do to discombobulate cancer cells is a positive thing. That's what we want. So the major difference between fasting and caloric restriction is the time required to reach the desired stress-resistant state, which makes fasting a much more appropriate dietary intervention. So fasting is better for you. You get to this stress-resistant state quicker with fasting than you do with caloric restriction. But if you can't fast, use caloric restriction. The whole thing is here, the whole message and the whole purpose here is I want to encourage everyone to begin to incorporate this into part of your healthy protocol to beat cancer. So we have fasting signaling pathways. And what these signaling pathways do is cancer sort of grabs hold of these signaling pathways and says, they're mine now, and I'm going to control them. And this is what it looks like. This is a lot of little initials. But the whole purpose here is, see that in the middle where it says mTOR? mTOR is mammalian target of rapamycin. Who makes up these names? I can't even imagine. So, but the mTOR is in the middle, and it's sort of like a crossing guard. And it brings in glucose, and it brings in energy and enzymes, and it really helps cells survive. It helps cells promote. It promotes angiogenesis, and it helps them live a long time and spread. So if we can impact mTOR, we have a lot of control over what happens with cancer cells. Now, there are drugs. They've done a lot of research. There's a drug called everolimus, which they use for lung cancer, which is impacting mTOR. But I'm a naturopath, and I like to use natural tools. And it's not one tool or the other. We want to use the best of both worlds to impact cancer, and that's what it takes, and that's my belief. So here we are. Fasting impacts mTOR. You're telling the crossing guard, mTOR, that it can't do what it wants to do. You're putting a stop sign in front of it, and I think that goes a long way to helping you know when you get hungry and you want to like throw in the towel, why am I doing this? I'm doing this because I'm telling the crossing guard it can't bring energy into the cells, and it can't help cells survive and promote and proliferate. And I think that really is important. It gives you a lot of empowerment. So here we have another study in 2018. There's a lot of studies. I must have read over 100 articles to put this presentation together. So here we have what happens metabolically with intermittent fasting. It encourages cells to die, and that's great. We want those cancer cells to die. Damaged cells, we want them to die. But it's not just the fasting that matters. If you fast, and then you go and you eat a hamburger, you're going to be sick physically, but then you're also going to diminish the impact that fasting has had on your body, right? So there's something called refeeding. So you fast and then you refeed. And how you break the fast is almost as important as what you do when you fast. So if after 7 days, they've studied what happens, you fast, after 7 days, what happens? The glucose returns back to normal. The ketone bodies, which had increased, which we want them to increase, right? They return to normal levels. The serum insulin had decreased, which is good. We don't like high serum insulin. Most Americans have high serum insulin because our diets are carbohydrates. And there was decreased signaling factor by IGF-1 by 45%, which is really good because that IGF-1 is a driving factor of glucose into cancer cells, and we do not want that. So what are the benefits of intermittent fasting? During treatment, as I said before, it increases the treatment effectiveness because the cancer cells are hungry and it grabs up that chemotherapy. It reduces the side effects because the healthy cells go into protection mode, and it protects the healthy cells. But after treatment, we have this longevity, which we all want, and there's cardiometabolic benefits, and there's weight management. Now, I'm not talking about being skinny, but what happens to women when they are put on hormonal treatment and some of these anti-cancer drugs is the body wants to hold on to as much estrogen as possible, so it grabs onto the exogenous estrogen in the fat. And before you know it, a woman has gained 15 pounds. Now, to gain 15 pounds when you've had breast cancer is not a good thing. And in my practice and in my online program, I really work with women to keep their weight down, not because we all need to be this anorexic, skinny thing that they have, the American advertising company has us believe that we should be, but because we want to be healthy. And it's a massive change in diet. And you can't eat American diet, American food, and not gain 15 pounds or 20 pounds or even more when you're on Lupron or aromatase inhibitors. It just doesn't work. So intermittent fasting is one of the ways that we can help with that, as well as a plant-based diet and juicing, and the ways that we're eating here are very healthy. So I talked about this, how fasting helps with chemotherapy. So, contraindications for fasting. Cancer-related cachexia, I've seen it in my practice. It's a very scary thing. And one of the things that I feel we can do, and in my practice, I use something called the healing smoothie, which is like it's a protein powder or a whey powder. We put a lot of ingredients in there that really provide essential nutrients to the woman, but also things like quercetin, which helps break up cancer cells. There's a lot you can put in a smoothie, and drinking a smoothie every day is one of the ways you can get essential nutrition. And it's up to the doctor to really notice if a woman is going into cancer-related cachexia, because that's very serious. And it's also up to everyone in this room to really know their bodies. And if you feel like you're into trouble, you need to speak up. Eating Ensure is not how you want to treat cancer-related cachexia. That's just, let's just go there. That's a horrible thing. I had somebody in my practice who was being given Ensure and wondering why she was not getting better, but getting worse. I had a very serious conversation with that oncologist. So, you know, if you have malnutrition, if you have abnormal liver function, you can't really do fasting. And if you have diabetes or hypoglycemia, sometimes you can fast with diabetes, it depends, but you have to really be working with a clinician who's experienced in this, and don't do that by yourself because you'll find yourself on the floor having passed out. We don't want that. So, how do we make fasting work for you? That's the whole purpose. I hope that you come away with this from this talk today, like really inspired to do this. Even if you only do it for 8 hours and then gradually increase to 10, that is a big improvement from eating dinner, having a snack, going to bed with food in your body, and then waking up and eating breakfast the next morning. It's like the eating the breakfast thing has gotten really disjointed in our culture. And it's all about the American advertising companies who put cardboard in a box with sugar and make us think that's what we need to have for breakfast with milk. I mean, that is like so not what our bodies need. We need to get empowered about what we're putting in our bodies and divorce this advertising companies. It really is a passion of mine here, as you can tell. So, additional aspects of fasting. This is what I've found. Most Americans are constipated. It's just a common fact. Even if you think that you aren't, you probably are. So, going in for treatment with a lot of fecal matter in your intestines or going in for surgery without having emptied your intestines is setting yourself up for trouble. So I always have people empty their intestines. You can do it through Smooth Move Tea. You can do it through Integrative Therapeutics, has a product called Laxative Formula. You can find it on Amazon. It is a great product. It should be called Good Poop Formula, because it doesn't give you diarrhea, it just gives you great poops. I encourage everybody to buy a bottle and start out by taking 1 or 2. Laxative Formula, Integrative Therapeutics. I have all the women I work with go into chemo with empty intestines and intermittent fast and do a healing smoothie, and their oncologists call me up and say, how come your patients are doing so well? And it's because they're doing well, because they're preparing. And what will you need for intermittent fasting? Beeler's broth, just a second, don't worry, I'm giving you all this information. Bone broth, your vegetable juices, fasting, you could do fasting mimicking diet products, laxative formula, as I said, by Integrative Therapeutics, and herbal teas. Now, I have all this information in a free ebook for you. Okay? My pleasure. So, just go there. It's there for you to download. Okay? I'm waiting. Okay?
Wait, go back.
Go back. Sorry. So, things to consider. Are there different fasting methods for different chemotherapies? We don't know this yet. Will different fasting methods address different cancers? We don't know this yet. And how can fasting become part of your life? That's my question to you. So, here's how to reach me. I'm in California, but I consult all over the world, Zoom and Skype. And I want to thank Anne. Questions? Anybody have any questions?
Great talk, Carol. Thank you very much.
Thank you so much.
And especially Dwight McKee, who's an integrative oncologist you may know of in the Bay Area.
I know him. He's my friend.
And yeah, Dwight's a fantastic oncologist, and he's had great success with his patients. So whether one does it 2 days before, the day of, and the day after, depends on the vitality, depends on many other variables, but it can be profoundly beneficial. So something to consider for everybody.
Thank you.
Great talk, thank you.
Thank you.
2 questions. Can cachexia be defined by a certain BMI number? And then the second question is, what numbers would indicate abnormal liver function? Like what AST or ASP numbers?
Okay, I can't give you the liver function numbers without like looking at them. But, and as far as the BMI, I think cachexia is not just one thing, it's a state. I mean, there is going to be abnormal blood work, and the woman or the person is going to have lost a lot of weight. But it's a whole syndrome. It's not just one thing. And I've seen it in my practice. So there's inflammatory markers, there's elevated ketones in the blood, there's protein, there's severe weight loss, and there's lethargy, and there's just this general energy of toxicity about the person. And I want to say it's a surgical emergency. It's not a surgical emergency. It's a functional medicine emergency to really, do some IV therapy, do some of these intense smoothies, because what happens is your desire to eat goes down, and then your body starts feeding on itself. So sometimes, I've had family members feed tablespoons of food to the person every 15 minutes until they got their taste buds back. So, but my whole deal is you want to prevent somebody from getting there in the first place. It's a preventable situation. If you're being monitored appropriately by your doctor, you shouldn't have CRC. Okay? You don't want to get there. You can prevent it. It's the doctor's job and your job also to be very assertive. I'm losing weight. I don't have an appetite. I have CRC, and you do not take Ensure. If this doctor doesn't know that, then you find somebody like me to help you, and you get out of it. You want to really take charge of your care.
Ann?
Oh, sorry. Yes.
We're doing both sides. A few questions. One is just so I understand it. You're talking about the intermittent fasting and if it's a time period that you're not fasting. What about water intake? Is that allowed during the time? So water all the way through, we're just talking about food products.
Thank you. Yeah, you want to stay hydrated. Absolutely.
Okay.
You absolutely want it to drink water, yes.
Okay. Second, you said it was contraindicated in diabetic patients and so forth. We have, I'm a doctor, we have patients, diabetic, we don't use medication. We're doing it and trying to do it and treating those nutritionally and plant-based wise. So I don't think that intermittent fasting would be contraindicated in that sort of patient. I think it's only with patients who are on medication that will drop the sugar as opposed to allowing it just to be utilized and metabolized.
The patients that you work with are not contraindicated. The patients that the regular doctors are working with who are on metformin and insulin, it's a different story.
Yes.
But if they're on berberine and they're working with you and they're doing nutritional work, of course it's fine. It's like, unfortunately, the majority of people out there are not seeing somebody like you. So it's fine for what you're doing.
And then the last thing, you were talking about the cancer cells wanting the glucose and that it shouldn't be restricted carbohydrate. But when we're dealing with a plant-based diet, we have a majority of our calories being carbohydrate. Now, I tell patients there's good carbohydrate and bad carbohydrate.
Right, exactly. So, yes, I don't feel like plant carbohydrates are bad carbohydrates. But if all you're eating is kabocha squash, then you're overloading your carbohydrates, right? I mean, it needs to be part of a whole plant-based diet. But there's a huge difference between carbohydrates from kabocha squash and sweet potatoes versus a muffin, even if it's gluten-free, right?
Right.
So, yes, that's a good point.
Okay, thanks.
Thank you.
Thank you. A comment and a question.
Sure.
So the comment is that I read that one of the other benefits of fasting is for the liver, because the liver has two functions, one to digest food and one to detox. And so by fasting, you're allowing the liver respite from digesting, and it then can do detoxification better.
That's true. Yeah.
My question is, could you re-explain why a healthy cell, while you're fasting and taking chemo, why the healthy cell wouldn't take up the chemo in an improved fashion as does the cancer cell?
That has to do with the Warburg effect, because cancer cells are very aggressive for going after sugar. And they use aerobic glycolysis for their sugar grabbing. Whereas when you're fasting, a healthy cell shuts down. it doesn't want the sugar so much. It goes into protection mode. So when the chemo comes in and the cancer cell is hungry, it grabs up the chemotherapy, whereas the healthy cell is going into fat production. It's getting their energy through ketones. So it's ketones versus sugar.
How do you recommend getting the ketones?
Well, you have to eat, like, I mean, there's different ways to eat. I mean, it's this complicated topic. I mean, if you want to, be in a ketogenic diet, then you would be eating you would be following a ketogenic diet, and you would be looking at your urine to see if you're in ketosis. But I don't think a ketogenic diet is applicable for everybody. So you have to find the diet that works for you. I mean, I'm not trying not to answer your question. It's like,
It's so complicated.
It is.
Just another comment, if I may.
Sure.
I'm aware that Mass General Hospital in Boston did some clinical trials on the ketogenic diet and did find that there was improvement for patients who had brain cancers.
Right. Yeah. I think that the ketogenic diet and brain cancers are an excellent way to go. And that's why there's different diets for different types of cancers and different treatments. So absolutely, yes. Thank you.
Do you ever work with people who have low blood sugar, or do you have any tips or tricks for someone who wants to try? But
Intermittent fasting with low blood sugar?
right.
I think we have to figure out why you're having low blood sugar before you do intermittent fasting. But you can, you could intermittent fast for 8 hours and then drink bone broth and maybe Beeler's broth, which is in my ebook, and then eat. I mean, that would be a good thing to do, but I wouldn't suggest a 14-hour intermittent fast if you have low blood sugar. But, fast for 8 hours, then do bone broth, and then do Beeler's broth, and then that will be helpful.
Thank you.
Yeah.
Hi, I was a little surprised to see your slide on water fasting is not as good.
I know.
Do you have, what is your preferred fasting? I mean, I do intermittent fasting, but if I wanted to do an extended fast, maybe once a month or once every other month, what would you?
For water?
Um,
What's the definition of an extended fast?
1 to 3 days.
Oh, yeah.
But you said not water only.
Well, I think a 3-day fast of water would be fine.
Okay.
But I wouldn't just eat regularly and then go into water fast. I would do 2 or 3 days of juice fasting and bone broth beforehand, and then I would make sure I'm emptying my intestines the entire time, a lot, because you don't want this building up.
Yeah,
and then do the 3 days of water fast, and then do another 3 days of Beeler's broth and bone broth and juicing afterwards. So that's the refeeding as important as the fasting. So the whole thing is lasting 3, 6, 9 days, right?
Yep.
3 days before, 3 days of, and then make sure you do probiotics or sauerkraut afterwards when you start eating food.
Okay.
Does that make sense?
Yep,
Yeah,
absolutely.
great.
Thanks.
Yeah.
Hi, thanks for a wonderful talk.
Sure, thank
So
you.
I'm a nurse, and some of the patients, not many, but some of the patients I work with have had either RNY, gastric bypass, or gastric sleeve.
Yeah.
And they need high protein, like 90 grams of protein a day.
Yeah, okay.
And are told to be eating around the clock. So, because I've talked about intermittent fasting with them, and they're like, I can't do that. So is there any resources you can have me go to, or?
I don't know of any literature that talk about intermittent fasting with gastric bypass, but 90 grams a day of protein, if you're doing some like plant-based protein powder, like a pea isolate protein powder, Zymogen, XYMOGEN, is a company in Florida. They have great pea isolate protein powder, OptiCleanse, GHI. I would not use Designs for Health also has really good pea isolate protein powder. Doesn't have Metagenics.
Does it have to be the isolate?
Yes.
And can it be soy or rice?
It could be, well, this is pea.
Right.
There's rice, Metagenics, Zymogen, Designs for Health, Apex International are all brands that I would.
But they can do the intermittent fasting?
I don't know about that.
Okay.
I'm not a gastric bypass expert. And I could ask a GI, I have a functional medicine GI colleague I could ask. If you give
Okay,
me your
check in.
information, I'll ask him when I get
Okay.
back and
Great.
send you an email.
Thank you.
Yeah.
Hi. So I find when I get up in the morning, I have to eat something, but then I can go like till 4 o'clock and then have lunch. So it would be like 8 o'clock eat and then 4 o'clock have lunch. Is that doing anything that fasting, or by having something in the morning at 8,
So if
it's
you
not
eat at
effective?
8, then 9, 10, 11, 12, 1, 2, 3, 4. That's 8 hours of intermittent fasting.
Okay.
And then you eat at 4?
Yeah,
You eat
that-
dinner at 4?
No, I have lunch then at
And then you
4.
eat dinner at
And
what?
then I have dinner.
Okay, that's just bad timing. That's kidding yourself.
Okay. So what you would recommend is like maybe start eating at 12 during the day and then stop at 8 o'clock at night?
If
Like,
you want to do that, yeah.
all right.
Right.
And just have water, I guess.
Yeah, water or black coffee, as Vulture Longo says. You can have black coffee. I don't know.
Setting in
All right, and the other question I want to know is, my doctor told me I have to take a statin for life. What do you recommend if someone has normal, has brought it down with eating more plant-based cholesterol?
I can't answer that, honey. I'm
Okay.
sorry.
All right.
I don't know your blood work. I don't, that would be irresponsible of me to answer that.
Okay, all right, well, thank you.
Thank you, Dr. Lourie, for your stimulating talk. I'm a physician. I've been doing intermittent fasting with my patient for over 15 years.
Great.
And we have been able to reverse the pathology of diabetes, high blood pressure, chronic diseases. I think it is very interesting to see that as Annie corrected us yesterday, that the traditional Egyptian medicine already has shown that if you fast for 3 days, there was some constellation that they looked at, and 3 days of fasting, and during this period they were able to, now we can capture it in a research, that 3 days of fasting increase your stem cells.
Yes.
So this is so valuable for anybody, cancer patient or patient with chronic disease, to be able to reverse pathology and to fast and to especially increase the stem cells. So also for the lady, bergamot works very well if you have hyperlipidemia. And intermittent fasting, it depends what you have to do during the day. I mean, if you're not working in the morning, you could fast, and then you start eating, later on, and then you take the 6-8 hours. But what I've been finding, most everybody is working, cancer patient and all, so the best thing is to have that breakfast. Don't eat anything during the day and have a late, early dinner, and that's it. And the early dinner has to be also 3 hours before you go to bed, so that you can stimulate your pancreas to increase your stem cells. Also, we should not forget about the total protein called Moringa oleifera for the vegans.
Absolutely. Moringa. Yes.
Hey, Doc, thanks for the great talk. And I just thought I would step up with all this confusion and everything. I will be your testimonial. I'm not one of your patients. However, I'm a stage 4 prostate survivor from, 6 years ago, 1 Lupron, and I was riding 4,000 or 5,000 miles a year on a bicycle at 15 miles an hour when I was a little faster, and I was around 220 to 230 pounds in the winter, and I could ride myself down to maybe 210 in the summer. I did keto until there were some contradictions for that. Keto got me down to about $1.90. Then I found all the intermittent fasting and time-restricted eating stuff, and now I do a 3-day fast probably once a quarter, and anytime I do intravenous vitamin C, I do a 24-hour fast. But I also, and I'm low carb, but not keto, low glycemic, so heavy on the vegetables, low protein. And I'm down to high school weight. I still have my little Lupron for in here. That will not go away, but I'm walking around $1.75. And and that's from intermittent fasting.
Yeah.
And my caloric intake is probably
And we
1,500
don't talk
a day.
about calories.
Well, I know you didn't,
we
but
don't
you
do
had that up there, but so I
I
thought I'd
know,
say it.
but in real life, we don't do, it's not about calories. Yes.
Yeah, I just want to make a distinction because I'm not clear in my head. So, time-restricted eating, so let's say someone eats at 8 a.m. and finishes by 8 p.m., okay?
That's 12 hours.
Then there's 12 hours. Are you suggesting that that's only something one should do for 3 days or 5 days, or that's just a good way to go?
It really depends. You could do it every day,
Yeah.
but the 12-hour thing isn't enough, right? You need to, a couple days, 12 hours is not when the physiological benefits of intermittent fasting come on. So really, you could do that as a way of life, but then maybe 3 or 4 times a week, extend that 12 hours to 14 hours. So instead of eating at 8 p.m., you eat at 6. And so then you're done. And then you have a couple times a week of 14 hours.
I say you suggest about 3 or 4 times a week,
Yeah.
14 hours.
Yeah.
Got it.
Yeah.
Hi there. Are there any cautionaries about if you are following, for instance, Jane McClellan's protocol of blocking, Jane McClellan
yes, yes, I know.
in blocking metabolic pathways, for instance, metformin? I'm not diabetic, but I'm taking that. Do you need to back off of that if you're going into?
I think Jane should answer that.
Okay. Because I just, there's a lot of supplements and drugs that are very.
She has a very
Okay.
specific program, and I don't want to answer that. She should answer that.
Okay, gotcha.
Okay, thank you all very much.